Hi there, I'm Audrey Christie, holistic wellness practitioner with audreychristie.com, and today we're talking about prednisone side effects, both in the short term and in the long term. Now, prednisone, it's an immunosuppressive drug and one that I happen to be particularly grateful for. I've had it used on me in the emergency room to stop a life-threatening anaphylactic reaction. I've also had to use it on my kiddo a few times to stop very aggressive immune reactions. It also is a part of the treatment plan of a lot of my clients. Their family doctor, their specialist prescribes them prednisone to help reduce acute reactions from, or acute flare-ups, acute surges, inflammatory surges of their autoimmune conditions or chronic health conditions, right? So, sometimes prednisone is necessary. It's necessary to save a body part, to save a life, or to just sort of pause or break the cycle when the immune system is in a hyper alert state, like what happens with autoimmune disease. And that's what it's good for, to address short-term urgent, also known as acute issues. Now, sadly, because conventional medicine generally believes, and would have you believe, that autoimmune disease isn't improvable or reversible, and then at best you're going to need long-term medication, which is sometimes the case, but not often. In the majority of cases with commitment from a client to make progressive lifestyle changes, autoimmune disease can actually be significantly reduced and even reversed, right? But the alternative to those lifestyle changes are these chronic immunosuppressive drugs like prednisone. Also, there's lots of other ones that they use, low-dose chemotherapy drugs and the like. So what happens when you take these low-dose immunotherapy drugs immunosuppressive drugs or prednisone is that you are stopping the immune system. You are just grinding it to a halt. And so what happens is that people die from relatively simple things that shouldn't kill somebody in 2019, right? Like the flu or strep or some kind of underlying infectious issue that wasn't addressed. So that's what happens when you take prednisone long-term, but it's just one of the problems. And that's why taking a functional approach and considering the whole patient, whole person, instead of just a singular organ system is really, really important before consenting to a particular intervention, especially when the answer is let's do this long-term. So I won't harp on the subject too long, but I use this example a lot. It's like taking prednisone for your thyroid condition or your rheumatoid arthritis long-term is like putting lemon essential oil in your water. A lot of people do this and they say they do it to detox the liver every morning, right? Now, if you look at it from a systems point of view, like you just focus on the liver, does lemon essential oil detox the liver? Yes. But that is taking a natural remedy and applying it to a particular organ, much like the conventional medicine applies prednisone to the thyroid or to the joints and rheumatoid arthritis. It's not considering the holistic view, the functional view. If you zoom out from the liver, you take that bigger picture look, the whole person look, you're damaging all of these organs to get that micro detox on the liver, okay? So medications like prednisone can be necessary, right? They can be life-saving, but at the very, very least, they're overprescribed. And we really have to be realistic about the consequences of using and overusing this medication. Unfortunately, I see prednisone happening as a first choice, right? Instead of being the backup choice or the choice when the situation is critical. We're using prednisone as a first choice when the situation is either not critical, the situation is chronic, and lifestyle changes haven't even been addressed or tried. So there's a lot more that can go wrong when you take prednisone long-term, other than taking the assault on the immune system. Let's look at the adrenal glands. They're already taxed because we're living in a chronic hyper-alert state. But even taking prednisone in the short term, for just one short-term usage, it takes months. Even in the short term, it takes months for your adrenal glands to return to normal, even just after that short usage. And so I'll often see a disease process start to creep up or be fueled that results in all sorts of symptoms from just that one issue. So what I want to leave you with today is that it is really, really important to be realistic and acknowledge that there are consequences that we need to understand, that we need to have informed consent about before taking medications in the short term, but especially in the long term. So I want you to ask your provider the next time you are given a prescription, the next time they say, take this, 3 questions that you need to ask. The first one, is there any option before trying this medication? What are the options? Is this it? Are we here? Is this the only thing left to do? Number 2, what are the unintended consequences, sometimes known as side effects, but unintended consequences of taking this medication? Now listen, here's the caveat. All medications, all interventions have intended and unintended consequences. They have the consequence that your doctor is trying to get, and then they have all the other consequences that happen as a result of putting that in your body. So ask what they are. If your doctor says there are none, they are full of it. So it's time to find a new doctor. Your doctor either doesn't know or doesn't care. I'm not sure which is scarier, but both of those things are important to know. Right? And the third thing is, what's the plan to get off this medication? Because these medications, whether it's over the counter and you can buy it at the drugstore or you have to have a prescription for it, they're not designed for long-term use. They weren't meant to be used that way. So it's really, really important to have your entire holistic basket of things looked at. So if you're on prednisone long-term, or if you've been prescribed it over and over and over again, maybe there is a root cause, or there's for sure a root cause that needs to be uncovered, right? Some pieces need to be put together in order to figure out what is going on with you. So if that's you, I invite you to put a comment below. Let me know what you're going through. You can also subscribe and click notifications. We're doing a whole series on autoimmune disease, and that way you'll be notified each time a video uploads on Tuesdays. The last thing I want to tell you is, if you want to have a mini case review, those are complimentary. I'll put that link in the description below. Also be sure to check out my other videos on Advil and birth control pills and all the things. If you have any questions, it is my honor to answer them. Be well.